So here's a little lecture that I gave very recently at the Cosmetic Surgery Forum in Nashville, Tennessee, and it's about my 3 favorite devices.
Hello, I'm Dr. Joe Niamtu, LoveThatFace.com, and I am going to put this lecture on YouTube, and at the end I'm going to have a little video that will show you how to see more lectures and 4K videos on cosmetic surgery. Today, this is a lecture that I gave recently at the Cosmetic Surgery Forum in Nashville, Tennessee. It's a big cosmetic meeting, and the premise of the lecture is that the doctors were supposed to describe their 3 favorite devices, and my devices I'm going to talk about today is the endoscope for removal of osteoma with scarless procedure, the Sonoquence radio wave system for mole removal and making incisions, and the Iridex Verilight vascular laser to treat spider veins, venous lakes, and a lot of other types of skin situations. In terms of disclosures, at any time you speak at a meeting, you have to tell them what other interests you have. I have a cosmetic facial surgery course, which is going to be April 1st and 2nd, 2022 this year. So anybody is invited of any specialty that wants to learn about cosmetic surgery. It's in Richmond, Virginia. I also have an online video series that you can preview and purchase for the most popular head and neck cosmetic surgery procedures. And I have 4 textbooks currently in print on cosmetic facial surgery. My new book is coming out in hopefully 2022, and these books have been translated into Spanish and Chinese. So we're going to first talk about osteomas. These are little bumps that patients present with, and you can see these little bumps on the forehead, and they can be as small as a pea or as big as a ping pong ball, and they are benign tumors of bone. They don't hurt anything. A true osteoma is benign. Many of these patients give a history of having some type of trauma, or they bumped their head or got hit in the head, and other patients it's just a random event happening. So basically, one of the problems, people think they have an osteoma because they feel a hard lump. However, it could be a cyst, it could be a lipoma, it could be a benign tumor or something else. So any bump on the head is not an osteoma. The only real way to identify osteomas, or the best way, is to do a 3D CT scan, and you can see the osteomas, and you can tell if they're just on the outside or if they would protrude deeper into the brain or something like that, which is extremely rare. So when patients call my office, and we see patients for this from all over the United States and internationally when there's no COVID, and basically they say, hey doc, I have an osteoma. Say, well, we need to get a CT scan or an x-ray to make sure it's an osteoma. There are some types of disease processes that cause multiple osteomas, and this is consistent with Gardner's syndrome, but this is, again, highly unusual. So the problem was that most people treat osteomas pretty aggressively by making a big incision in the scalp or in the forehead and grinding these down. And nobody wants to have an invasive technique like that if there's something else available. Other doctors, this is not an osteoma, this happens to be a lipoma, but other doctors will do an approach where they make an incision right over the osteoma, and that's going to leave a scar and makes it hard to really get the whole osteoma removed. So my goal was a more technologically advanced and less invasive means of treating benign osteomas. So I began this technique of using an endoscope, which I use routinely for brow lifts, and an orthopedic device to shave down bone. So if you look on the left, you can see the view that I see through the endoscope,
And on the right, you can see the endoscope inserted in the patient's hairline. Now, we use this instrument, and this is actually happening underwater, where we're shaving off the osteoma. So we just reduce that with this shaving type of instrument. And here is a before on the left, and then you can see the skull, the frontal bone on the right, with after the treatment. So you can see how smooth it is. So the left is before, the right is after. And then we use a small diamond file. Remember, these are very magnified views, and we smooth down the bone to a polished surface. Then we close this incision, and again, it's just one small incision with dissolvable stitches. So most people come here from out of town, and they stay overnight and leave the next day. The procedure takes about a half hour, and the satisfaction rate has been 100%. And so far, I've not had one of these return. So here's a before and after, before on the left, after on the right. That was a patient's osteoma endoscopic view, before and after. Another before and after. So these patients are very happy because they've been walking around with this all their life, and when they meet people or get in a conversation, people tend to stare at something like that, and it's embarrassing for the patient. Before, after, that's a double osteoma. You can see there were two, and that's before, after. Again, another double osteoma, before, after. This is a triple. So you can see there were three osteomas here, and this is before, after the clinical picture, and endoscopically, this is the osteomas before and after I shaved them down. The next device is the Sonoquence 4.0 megahertz radio wave system, and this is a new radio wave system. Many of you are familiar with the Elman system. This is another competing product of similar technology, and has some upgrades, and I've been using this for the last year, and it's a very useful machine. I use it for removing moles and warts and various types of facial growth, and I also use it for surgical treatment, which I'll show you. So this is a fast forward of a mole removal, and in this case I'm biopsying the mole, and then we're going to use the Sonoquence radio wave system and carefully melt down this mole. And I probably have done 10,000 of these over the decades, and it's the closest thing that I have found to scarless mole removal. And it takes about 5 minutes to do a mole. This is a kind of a typical before and after. This is the actual patient that I showed you in that video. And so on the left is a before. The middle picture shows what the area looks like immediately after treatment, and it takes about a week to heal. The patient just covers this with Vaseline or Neosporin. And the right is the 8-week picture. I usually take my after pictures on 8 weeks. And again, these are just some befores and afters of various benign lesions that I treat. And I see, again, people from all over the United States, and when there's no COVID, I do see some international patients for simple mole removal. I can't tell you how many patients have come to my office that walked around all their life because their dermatologist or plastic surgeon said that the treatment would be worse than the mole, and that is simply untrue. Most of these respond very, very well. And these are called DPNs. They are common in darker skinned patients, and this is also an effective way to treat these lesions. I also use this device for surgical procedures, the 4.0 Sonoquence radio wave system. On the left, I'm using it for blepharoplasty, cosmetic eyelid surgery. On the right, I'm using it for facelift surgery. So it's a very useful device for surgeons to have in the office. Finally, the third device is the Iridex vascular laser. This is really a workhorse, and I use this to treat a lot of different vascular lesions, and it is 940 and 532 nanometers. So for the doctors that are watching this, excuse me, those are very useful wavelengths to have in the office. So it literally erases spider veins. This is fast forward, but you can see that it's just almost like Pac-Man. You treat these spider veins and it just erases them. And again, people present with these situations and they have these spider veins and they walk in and 10 minutes later they walk out of my office without the spider veins. So it's a very popular treatment for these types of situations. I also use them for venous lakes or small hemangiomas of the lip. And again, I have people coming from all around for this simple treatment. Obviously, I'm not the only guy on the planet that does it, but I do a lot of them. And you can treat those lesions in 5 minutes, and usually it only requires a single treatment. Every once in a while, any of these, even moles, may need a touch-up, but that's a very small percentage. And when you're treating these patients are very happy. And we can treat some smaller birthmarks, which I really don't do much anymore since I have such a large facelift and eyelid practice, but this device will do that. So these are 3 devices that I use daily in my office, and the Osteoma is pretty unique. I'm one of the few people that do this, hence I have people coming from all over for that procedure. The mole removal is really pretty amazing. It really makes people feel good to get rid of these moles, and I've never had a patient that said that they wish they had their mole back. In other words, the resultant scar is always acceptable and better than the mole, and a small amount of patients may need a touch-up, and it is a very technique-oriented procedure. It's more of an art than a science. You have to know what settings to use and when to stop. And the problem is that I see so many patients come into my office and they had moles removed and they have just horrible scars, white, hypopigmented, dented scars, and that's pretty much unnecessary. I only treat moles on the face and neck. So anyhow, this was just a quick lecture I gave. This is my ending slide for all my lectures. I have saved all my badges from the many hundreds of meetings of continuing education that I have lectured at. And I think it's important to always be a teacher and always be a student. Please stay tuned for a short video to give you some information about my 4K video series, which also has many lectures and over 50 hours of video on many different cosmetic surgery subjects. I'm Dr. Joe Niamtu, LoveThatFace.com.
Hi, I'm Dr. Joe Niamtu, LoveThatFace.com, and I'm so excited to introduce and release version 3, our Platinum lecture and video series. I've had 2 versions in the past, and we have sold these in over 70 countries and educated hundreds of doctors with these videos. I've really put everything I have into this. I did all the surgery, I did all the narration, all the filming, all the editing, and I've worked for over a year on this. We have many, many hours of videos on 11 topics. You can download these on any device and own them, and it's all in stunning 4K video. I'm going to show you some of the footage of the various videos, and you can purchase this at LoveThatFace.com under physician information or at cosmeticsurgeryeducation.com. Stay tuned and watch. The neuromodulator series includes common injections of the head, face, and neck. The injectable filler series includes common injections of the head, face, and neck. The Blepharoplasty series includes almost 8 hours of multimodality scalpel, CO2 laser, radio wave surgery, electrosurgery, and canthopexy. There are almost 9 hours of comprehensive facelift surgery, as well as a separate series on minimally invasive facelift. The brow and forehead section includes many open techniques as well as endoscopic techniques. The skin resurfacing series includes chemical peel as well as laser skin resurfacing of the face, neck, scars, and acne. The facial implant series includes silicone, cheek, and chin implants in great detail. The fat management series includes jowl liposuction, submental liposuction, and buccal fat reduction. The otoplasty series includes multiple cases of cosmetic otoplasty for protruding ears, and the subnasal lip lift series details that procedure. Because there are lectures and videos included, this is actually a mini course, and it's a great adjunct in helping learn cosmetic facial surgery or review for experienced practitioners. Each series can be previewed or purchased individually, or the entire Platinum Comprehensive collection can be purchased. To preview or to purchase videos, visit cosmeticsurgeryeducation.com or lovethatface.com and click under Physician Education. Thank you so much for your time. I'm Dr. Joe Niamtu.